Today I'm with Caryn Isaacs with Get Health Help, a longtime patient advocate and a real expert in her field. And I have a question for Caryn today. I'm hoping she can help us. Caryn, I heard from a patient's family member that after the patient was brought to the emergency room and they were treated overnight, they received a bill from the emergency room and a very high copayment. Could you tell me why something like that would happen? Why wouldn't the insurance pick up payment?
Yeah, so there's something called observation, which is a billing term related to Part B. That's the doctor's portion of the Medicare coverage. Part A is your hospital coverage. But what people don't know about, because even the doctors don't know about it, the doctor is responsible for deciding if the patient is admitted to the hospital or they're still considered being treated in the emergency room. So when you walk into the emergency room and you're treated, you're given some tests, and then they're looking at the test results, and then they're trying to decide what they should do. If they can do it in the emergency room, then you would still be considered an outpatient. So that's why your Part B is covering these services and not the Part A, which is your hospital coverage.
So, how would we avoid that as a patient or family member when we end up in the emergency room? Is there something we should be saying or doing to avoid that from happening?
Yes, unfortunately, this is one of the loopholes that Medicare feels that it had closed, which is that they don't want people to go to the emergency room. They would prefer that you call your primary care physician, that you go to one of the urgent care centers, and then you would understand, you would have to realize that this was a regular office visit and everything would be covered under the Part B coverage. The hospital is really for the real urgent care, so the types of services like a gunshot wound, you have a heart chest pain, and you are taken in, and the doctor might admit you if you continue to have pain. But your first step should always be to call your own physician, or to go to an urgent care center close to you that can determine if this is a real emergency, and then they would send you to the hospital if they felt that that was what was needed, and then you would be then hopefully it would be done. But the doctor is not the one who does the billing. So even though a doctor may see you in the emergency room and say, I'm glad you came in. It was really important for you to be seen. We needed to do these tests. We needed to do certain treatments. That doctor is still not the one who decides what the billing is. So unless you're a billing expert, at the same time as you're feeling those chest pains, you're not really going to avoid it. It's just to know in advance that that shouldn't be your first decision to go to the emergency room. If you have a splinter or you have a little cut, you're having a cough, you have something that's already been happening for a few days, the emergency room is not the place to go.
Is it all the time? Is it for everybody, or is it all Medicare, or is it for all insurance?
Well, this is for Medicare, but most insurance companies follow the Medicare rules. So Medicare is a national service that makes the rules and regulations that says this is good medicine and it's been approved by all the powers that be, whether it be the various Department of Health and the Medical Society, and it's been tried and true. So there's no real appeal. In fact, Medicare does not allow appeals to this ruling. So if your claim is denied because you were underpaid because it was considered a Part B service, then chances are that your insurance is also going to go along with that and also deny any kind of appeal.